Good evening and welcome to Mental Health Matters After Hours. Now, if you're here to gain a little bit more insight into our topics, perhaps you want to top up your academic knowledge, perhaps you're looking for support, or maybe you just want to engage in some self-development, you've come to the right place. This is the show where we take a deep dive into all things mental health and well-being, and we are thrilled to bring you the leaders in the field and the practitioners who are doing this day to day to really deep dive into all our topics. Today, we are bringing Dr. Juan. She has been working on mindfulness calligraphy enhanced therapy to make therapy more accessible to the Chinese community. And in today's show, she will be looking at how we can make healing and therapy far more accessible across all communities. So let's head over to the studio. Good evening, Juan. It's such a pleasure to have you back with us. And it was such a lovely session that we had with you last time where we engaged with your calligraphy practice. And that was really, really wonderful. So welcome back. And you wanted to talk specifically about the decolonialization of therapy. So I wanted to kind of ask, how do you feel that therapy's been colonialized or colonized in the first place, and what effect does that have on people?
Well, I think first of all, therapy, psychology is a very Western concept. So if you're looking at there's in practice, there's research. If you're looking for research paper, perhaps over 80% of the research have been done in Europe and the US. And most of the research participants are white. But when we work in therapeutically, we work in the much more multicultural communities.
Yes.
And in terms of training, my own experience is it is a very Western approach, and then often it is about the West understand the philosophy also from very Western perspective. I think the culture barriers will rise when in terms of actual work with the communities. So I think it's a very important issue. I think we can't ignore the issue, and both for the people who run the institution, also people who are training, and the end of days, we want to provide good service for the community. We want to work with individuals, understand their experiences, rather than having, the approach was. It's about, for me, it's very creative. Therapy should be creative, inclusive.
I absolutely hear you about that inclusivity, because what you've spoken about in the past is when the style of therapy, for example, two people sat in a room, one talks to the other, shares their dark secrets without even having any kind of prior relationship or experience with that person. That can be really alien, especially to certain cultures, certainly in Southeast Asia, that would not be seen as a particularly healing environment. And you're right to talk about how a lot of these standard forms of therapy have been based in Western approaches. Yeah. So can you give me an example of some of the assumptions that therapy makes, which a cultural inclusive approach might need to address?
Well, I think, for example, I work with Chinese communities quite often, and we talk about a culture much more individualistic.
Yes.
In a Western society. Yeah, we automatically assume the person will have their own ideas about life and everything that's individual.
Yeah.
And then while the culture I grown up is a much more collective culture. It's about social relationship and connecting with others. So in for example, one is a good example. Maybe the clients might call me sister.
Wow.
Yeah, it is. I have never had a white client call me sister or aunt,
of course,
or anything.
Yes.
Yeah, address me as first name. Or maybe with title, but in Chinese community, I'm this is a quite interesting experience for me as well, because, you know, what does that mean? So people maybe perceive respect to you, yeah,
Yes.
as a professional, and also want to build in connections. And then that's an important thing to work. You know, you could take an ethical lens for it, but also I think it's important to understand what does this means. Yeah, the client
Yes.
prioritize, you know, the social relationship, the community. It is a way of fund intimacy and connection with it.
Yes.
So, you know, that if you purely apply for ethical lenses with a Western, you know, framework, you might not really willing to engage that intimate relationship. Not mean I am no. It's about understanding what does that means to the client, right?
Yes.
Yeah.
It makes, and to perhaps even recognise that it is a mark of respect, but and that has implications for the therapeutic process, but
Absolutely.
But also it's not necessarily somebody trying to make a relationship more intimate than it actually is. So yeah, it's about that understanding. I get called auntie all the time in Southeast Asia. That's the mark of respect. Yeah.
Oh wow.
Because I'm older.
So even in a work
yeah.
scenario. Oh.
You can. Yes.
Gosh.
Yeah. So
Yeah, you if like address me as a first name can be not show not respect enough.
Really? That's
Yeah,
so
yeah,
interesting. Okay.
that is really interesting.
I think therapeutically it's a really rich experience, you know, to explore. But if I don't have the experience in a community, I wouldn't be able to, you know, explore that. But I think you know, it's also talk about a community as a whole. I think the connections. I think in Asian culture is really there's a lot of emphasis on social harmony.
Yes.
Yeah. So understand the conflict and the trauma. You have to put it in the right context.
Yeah, absolutely. So, but this is so interesting. So therapy now does take into account intergenerational trauma. But do you think the Eurocentric methods can truly enable somebody to be understood, let alone them start to heal?
I think it's a really complex question. I think I don't have a definite answer for that, but I do think if we, my background relatively actually quite easy, straightforward to explain, right? I was born in China, grown up in China, came to UK, so it's quite straightforward. But there's lots of people who might be not so straightforward. So that maybe the parents are the, let's say, first generation.
Yes.
Yeah, they're second generation, but they also speak. Let's say they speak English as first language.
Yeah.
Yeah. Yeah, but they are on appearance. They look like Chinese or other Asian from other Asian. This understanding the intergenerational trauma, but also understand their identity.
Yes.
Yes.
Yeah.
And that's
So it's something I found it's fascinating in the therapeutic context, and it's about really to offer that foundation to help a client to explore.
yeah. So there's so many aspects to it, aren't there?
Yeah.
That probably we wouldn't normally think about, but it's so important to understand from both sides.
And we wouldn't normally be taught either.
No,
Actually, when
no.
you think about it in clinical practice, this is not necessarily something, you don't have a whole module.
Yes.
Maybe we should.
Yes.
So, based on that, Juan, how do we avoid therapy then seeming a bit white saviour, which it can feel perhaps to, especially somebody who's come over from who's migrated. So I'm just thinking about my own parents. They've come over from Malaysia. Maybe they've got issues, say. So they already have a respect for the English man or woman because they were part of a colony.
Yes.
So they go to therapy, and not only is the respect afforded because that person is a doctor or in a position of power, but there's an extra respect afforded because of the whole Malaysia was a colony thing. That's huge.
Yeah.
Yeah, absolutely. I mean, it's I think that's something. It's there's lots of talk about white supremacy, right? I think it's for me, understand the power dynamic is one of the very important things building therapeutic relationships.
Yeah, I think that's the simplest thing, isn't it?
Yes, exactly. Everything can be broken down to that, can't it?
And the power dynamic is one which is clear in a therapeutic relationship, because it is that not only are you coming to somebody for support, but you're coming to somebody for support in a position where they are sort of an authority.
Well, they
or
are.
in your perception, they are an authority. That is really important. Thank you. We shall keep you. We're going to be back just after this. Welcome back to Mental Health Matters. We are talking with Juan Du, and Dr. Juan Du, I should say, because since we last saw you, you have had the whole PhD. It's all come through, and it's wonderful. And congratulations. First of all. And the topic today is the decolonisation of therapy, which we've already seen. There's so much tied up with the Western approach to therapy.
Yeah, absolutely. And what are the problems with taking a Westernized approach to a non-Western problem?
I'm actually writing a book proposal with a scholar from Turkey.
Okay.
The reason we try to put together is because so I raised this problem, and this person also raised the same problem. So it's quite interesting. We talk about therapy in the UK and compared, in terms of training in Turkey, it's the same. They translated everything in the Turkish from US, like CBT, for example. People who train in CBT is exactly same thing, just translated. Yeah, can you see the problems?
Yes,
because the clinicians are. The approach is not culturally integrated. So, and for me, in terms of my understanding, trainees often in the culture sensitivity is about not saying things very rude, and not about actually diving to be able to open about it.
Okay.
I don't really recall any modules specifically understand the culture sensitivity or criticizing Westernized approach.
Yeah, and for Westerners, the Westernized approach makes perfect sense.
Yes.
But I can see how just a direct translation is already teaching new therapists from all cultures, this is the only way.
Yes.
And that's not true.
No, and I can see that some direct approaches might be perceived as being rude from other cultures, and it's just not going to work or be welcomed by other cultures as a way of therapy. So, what methods have you seen that truly show a cultural understanding of what is needed in the therapeutic space?
I think it's more than one method. I think it's about, for me, develop mindfulness calligraphy enhanced therapy the intention was bridging the underrepresented communities. And I think, method, there's many clinicians and are keen, working with their community to develop, but I don't feel there's enough encouragement as for the industry as a whole to develop or encouraging people being more innovative and creative.
Okay.
I'm saying from my own experience.
Yes.
Yeah. When people go through training, they go into the institution. All the modules are, we'll talk about accredited courses. That's set. Yeah. They may have one or two seminar or something, talk about culture understanding. They might get people coming to talk about their experience, but that's about it.
Gosh.
There's no, at least for my doctoral experience, and then people I know, and they're never being encouraged to develop something.
Okay, that's
Yeah.
And I just feel like if you're doing a doctorate, you're meant to contribute something, to the field.
And almost what you're probably seeing, and I think I see this as well, is the people who, from different cultures, who become successful, still practice within the same remit as the Western predecessors, rather than actually creating something different and new, which could serve the community better.
And I do think communities deserve it,
Yes. Oh gosh, yes, absolutely. Absolutely.
It's interesting because when I did my teaching practice, and that was 13 years ago now, cultural differences was a part of the course, and we learned about art therapy, we learned about, music therapy, so for children. So it was kind of known about in the teaching world, and I would have thought that actually the therapy world would have led with that, but it sounds like still it isn't. That's quite interesting. So how can therapists broaden their understanding, or would it be more that they would refer to others and signpost elsewhere if they didn't have that experience?
What I think is, we all working within our competency. I think the important thing is therapists, we're also human beings. It's the commitment of a continual learning and exploring with the clients and acknowledging our limitations. Culture sensitivity, we might not get it, but taking a much more open approach rather than become defensive. I think sometimes, people, I have experienced, someone told me, I've done this for 20 years, and, I was, when I talk about things I develop, I know it doesn't make sense to me. I've done this for 20 years.
Okay.
That's how and I just, at the time, I just thought, wow, this is, I respect you're doing things for 20 years, but you're doing things repetitively without reflection for 20 years. It's very different from someone say, I have a rich experience for 20 years, but for me, it's important is your continue learning.
Of course.
The learning is not about I'm taking CBT, I take. It's about you really embrace the learning and the beginner mind. Because at the end of the day, we work in mental health. For me, is every client or patient is different. The traumas are different. Yeah. And they always have, for me, I've learned so much from actually clinical practice rather than the theoretical learning.
Yes.
Because that's the real world issues. And then we understanding myself, my limitations, and the dynamic between me and the client in the room, and how little I know about the person sitting in front of me, and I'm willing to reflect on that. So I think it's at the end of the day, it's about we be able to not taking us, not ego driven.
Yes.
It's about down to us. Actually, every person come in is a new person.
Yes.
Yeah.
Yes.
I think sometimes that's the human connections, where you see the person as a human being.
Yeah.
Not that one of the patients you're going to see a day, or one of the clients you're going to see the day. It's as an individual human being has their own story and their own narrative, their own traumatic experience, and then maybe there's embodied trauma, and then we have to honoring that.
That's beautiful. I like the point about honouring that what somebody's gone through, and the narrative they use to explain what they're going through as well. Now, we briefly mentioned sort of intergenerational trauma as an example that can impact a lot more people sometimes who've been through their own cultural wars and so on, that they then present in a Western place. But something that you said, this is way back in a different interview. There's also language and what we use to explain, and there's certain words which people will use, say in Chinese, that we have no understanding of in the UK, and their meaning is very different. So when they're explaining their narrative, if we have no other word, we can make a presumption, oh, that's what you mean. So do you mind sort of expanding on how, A, problematic that is, and how we can actually begin to approach that more sensitively?
Yeah, I think, first of all, you still remember previous interviews. Wonderful, thank you. And I think, culturally, there's all, a linguistic meaning, and then the embedded culture meaning. Sometimes they're operate on the different levels. And I think, from my understanding of the Chinese culture, and then in different generations as well. So sometimes some young people, not all, they're much more direct, and then perhaps in their parents. But they're not all. And we talk about social harmony, that kind of culture, talk about negative emotions. Talk about, for example, a trauma, talk about, let's say, hatred, feeling of hate somebody. This is a very strong emotion. And strong emotion, if the culture are not brought up with it or suppress it, then in the therapeutic, they might not express it in that way.
Yes.
Yeah, and we talk about the easter wind and west wind. They have in the literal meaning is just the wind from different directions, but it is there's a meaning when they use in the sentences, and then there's meaning when people. I think it is in terms of fascination. In terms of how I understand the culture and the language and the place I brought up. Often, even the same language, there are different meanings.
Yes.
Yeah, and then we speak the same language, but because I was born in a different region, I understand differently. So I have to update my knowledge. It is something I found, for me, is really exercise, sharpening my brain. Is there's vocabulary, are new vocabularies.
Yeah.
And then on the internet vocabularies, TikTok vocabularies.
Yeah.
I don't, and then it appears in a therapeutic space. I know sometimes I haven't got a clue what does that means. So I have to, being willing to learn. Yeah, and without worried, my clients might see me not having enough knowledge in that.
Yeah, but still it's about understanding what that person's really trying to say beneath the language they're using.
Exactly. Really try to understand the context of what they're trying to say, what they're trying to express.
Yeah, and our assumption, maybe not my assumption, which is a very poor assumption actually, is, well, you're speaking English, that means you must know all the words that I'm using, and therefore when you use that particular word, it must mean what I think it means. Of course it doesn't.
Yeah, well, I think we all would assume the same thing. I don't think it's just you,
And it's frightening. Now, based on that, this is a bit of a devil's advocate question. So, because for many people, depression is depression. Whatever the trigger is, doesn't matter. Burnout's burnout, no matter what caused it. Of course, that's not the case when we're talking about taking a more culturally sensitive approach. You're not necessarily just treating depression, full stop.
No.
You could be treating, well, you may not even be treating the word. You might be treating insecurity or frustration or something else. How do we really begin to appreciate that?
Yeah, it is a very good question. I think for me, depression is more than just medical terminology. It's really understanding the person, their body, their mind, and their spirit. And I think I can give you a recent example. So I've been interested in traditional Chinese medicine. So I had last month I was observing one of the clinic done by an acupuncturist, treat depression. And it was quite interesting to understand how, from a Chinese medicine point of view, treat depression, and how Western point of view understand depression. But what something is there is a common. Is for example, if you work with people with chronic depression, and then for me as a clinician, and then there might be, really low mood and feeling depressed, and then, going through that all the time and talk about in a session. But then there was something there. Then you see the spark in the eyes. I don't know if you know what I mean.
Mm-hmm.
Yeah.
Something could be something in terms of their relationship with someone, or something happened, their hobbies, or could be anything, or maybe it happened in the past. Then you see the spark. And for me, from body, mind, to spirit, it's very important to be able to capture that spark and cultivate that. And this is really resonate with the Chinese medicine, because in Chinese medicine, there's a word called Shen. Shen is about indicator of a person's overall well-being. Mm. So there's a 5 spirit of Chinese medicine, that Shen is one of them. So it is associated with the heart, and then it's with the spirit. So as I was observing the acupuncture doing that, I did ask a few questions. Did you see that the person, the spark in the eyes and this and that? It was quite, for me, it was eye-opening, because I feel connected. From clinical perspective, I feel connected. Do you know what I mean?
Yes.
Although we have very different jobs in terms of work with people, but I feel connected, because understand the sparks in Chinese medicine. The treatment could be acupuncture, could be herbal, could be dietary changes, lifestyle adjustment, but it's understand the imbalance, how this person maybe chronic depression in their body. With the Chinese medicine, we'll talk about the liver, the qi, and then. But as a psychologist, I also kind of really, almost in a therapeutic context, I want to help the client to cultivate that spark.
Yes.
The spirit part of it. So we will work. I will ask about it. I will encouraging clients to talk about it. Yeah, because when people who maybe depressed for a long time, those are the moments. What I see is almost like the light on the lighthouse.
Yes.
Yeah.
Yeah. It just flashes for a moment. And
yeah,
then goes.
Exactly. And you want to capture that.
Yes.
And then this is but with the culture sensitive understanding. Oh, okay. But in psychology, you wouldn't say, oh, that's because your liver lack of a qi, yeah.
Yes.
But it has good understanding for me. Is okay. From Chinese medicine point of view, that's how your body interact and how this energetic flow. And then if the person come from Chinese community, they will understand what a Shen means.
Mm-hmm. Yes, yeah, and they would understand it without having to have that description.
Yes, and the explanation.
And so on. And it's really interesting.
Exactly.
It's interesting you say that, because that's something where it can be missed in Western therapy sometimes, when the focus is so much on the symptoms and so on. And yet, when you said it just reminds me of some of the conversations we've had where you're not a trained therapist, but you pick up on the spark of when someone changes in their demeanour. That's how I've been trained as a coach, strangely enough.
Oh, wow.
So, but it's really interesting. Juan, we're keeping you. We'll be back just after this.
I actually wrote this book for the purpose of disconnecting the trauma bond, because we need to shift the focus, and we can't shift the focus by talking about it. We actually need practical tools to move this forward. And this book is actually filled with over 50 little exercises. It's a little bit like a buffet where you can try out, and you like it, you put it in your toolbox. It's all about building your own toolbox, and it's designed to help you shift your focus away from them and what has happened and onto yourself and your healing and finding back to you.
Hi, my name is Dr. Constance Leland, the host of Level Up Circle, where I elevate the world through education, one learner at a time. Join me on Fresh Takes Thursdays at 9 a.m. PST, right here on E360 TV.
Our passion for coffee goes way beyond the cup. We believe in a fair production chain in which each coffee farmer plays an essential role. We are proud to support our communities and promote environmental sustainability. Bedford Coffee Roasters guarantees an exceptional experience for producers and consumers. Join us on our journey to extraordinary coffee, where quality, sustainability and fairness come together to create an experience unlike any other. Ground with passion, served with pride. Bedford Coffee Roasters, coffee worth drinking.
Welcome back to Mental Health Matters. We've got Dr. Juan here, and we are talking about the importance of having a culturally sensitive approach to therapy, because not only might words carry different meaning, but narratives can carry different meaning. And of course, the person themselves comes from a very different approach. You've got the collective society versus the individual society. And just even recently, we were talking to a sex therapist, and she was saying that when you take a more Eastern approach to understanding what's going on, the community becomes such a key element of that, which isn't so much seen in Western society.
No.
So I think our whole cultural upbringing is different, and all of that needs to be understood.
Yeah.
Oh my goodness. Okay, so let's look at the positives. Apart from, of course, your brilliant mindfulness calligraphy enhanced therapy, which we so enjoyed.
We really
so
loved
relaxing.
that. Yes.
What other therapeutic innovations have you seen that you found particularly insightful or useful?
What I think is also, it depends on the client, the context of the client. For me, is I'm really drawing with the Eastern philosophy and Zen, and from a much more holistic approach. So I found that is resonant with me, how I understand human experiences and human distress. One thing I would, I recently I've learned something which is, maybe not aligned with the positive psychology, is about how we cultivate to understand from a very young age, life is not always go on your way.
Yes.
Yeah.
Yes.
From a very young age, it's understand failure, understand fail.
That's a huge thing. I love that, because very recently I've been doing a lot of reading around compassion at the moment. It sparked my interest. And one of the key things there, they always talk about Buddhist philosophy and absolutely understanding that suffering is the norm of the world.
Yeah.
It is, and that understanding actually makes it a lot easier to then say, okay, I'm not coping, I'm suffering, I'm struggling, but I'm still okay. That's okay, and it's much easier to accept when you kind of go, well, that's what the world is. But I love your point about positive psychology, because of course the positive psychologist may be more akin to be saying, yes, but always look for the positives. And it's more for me now, my understanding of it, and I was from that school, is to say, well, okay, the world can be pretty crappy. It just can. But then we can just, if we just look for those moments of brightness, even though the nucleus of the world, the core of the world could be hard, there are these little pockets of light, and those little pockets of light are great.
Yeah.
But it's not all beautiful and shiny, and it does put it makes me a lot calmer to know that.
It is about, where you take,
Yes.
You think about the waves on the sea, right?
Yes.
The waves that come and go.
Yes.
So where are you? Are you the drop of the water, or are you the sea?
Yeah.
Yeah.
Yeah. And it's the positive bit,
Yeah.
the drop or the sea, and I love that.
The wave hit you.
Yeah.
If you're the rock, the wave hits you and the wave goes.
Yeah.
If we say, no, I can't let that hit me. Yeah.
Yeah.
Then your world is very limited.
Yes.
Right?
Yes.
Yeah. Because the waves coming hit you, or hit the rock, or move away. It has everything to do with the earth, with the moon. Yeah. It's something out of your control.
Yes. Yeah. And a lot of problems stem from trying to stop the wave from hitting you.
Yes,
But it's
exactly.
going to happen anyway. And if you're a rock and you can't move.
Yeah.
Exactly. But if you embrace that, it is a part of a life.
Yeah.
Yes. It really, that embracing, comes specifically from, to me at least, and I've done so much reading in psychology in general, but it was only just connecting it with the Buddhist approach of suffering is normal. So that brings me to the next question of what is missing when it comes to training clinicians, because you're already saying, and I agree with you, there's no module.
Yeah, that's a big gap, isn't it?
Yeah, I think that's, when we work across culture, I think it really, to be honest, I would like to, one day, I don't know, maybe one of the university or institution offers a Buddhist psychology and psychotherapy.
Yes.
Yeah.
Well, they're calling it acceptance and commitment therapy at the moment.
Eastern philosophy based mental health psychotherapy.
Yes.
And has a team to really committed to do the research and deliver the approach. But I think it's I don't know when it's going to happen, but it would be something will benefit for the communities. Yeah. But it is at the moment I feel engaging, be able to engage a client from different background, be able to understand the culture humility, and to understand our limitations and what are their limitations. So sometimes I have learned as much as from client. Yeah, they told me so much.
Yeah.
And it's a wonderful experience. I just feel very lucky to do the job.
That really comes across.
Beautiful.
It really does come across. It's lovely. So for somebody looking for therapy, do you think a blended approach is best of different cultures, or is it horses for courses? How would you? What's your opinion on a blended approach of therapy?
Well, I trained integrative, so I'm probably biased. But I do think for clients going to therapy is, I would say just give try different approaches, and then that I like Audrey said, the authentic self. Approach is enabled you to embrace the authentic self.
So really, it's what feels best for you. How what sits really well for the client.
Yeah, you feel empowered. And for me, it's not about just approach. It could be the therapeutic space, the therapist, and also the approach, and also just the it's quite complex in terms of multi-factors there. But I think it just I will empower clients to go, if they do assessment sessions or formulation, just try a few different ones.
Yes.
And then earning the power, you are choosing the one is right for you.
Yes,
Brilliant.
I like that.
Yes, empowering yourself. Thank you. And how do you think the field needs to change so that more communities, more cultures will seek therapy?
It's very good question. I think for me, the definition therapy is not just rigid, two coaches in a room.
Yes.
Yeah. I think as a community, I think we as a society, it's from well-being perspective, we should promote people who willing to looking for approaches, maybe self-care, from self-care perspective, or maybe from in terms of treatment perspective, to enhance their life experience, to thrive. As a culture as a whole, because most of the time we hear is people, it's quite difficult. Therapy can be quite expensive.
Yes.
Right? And scary.
Yes.
And scary. So I think to understand the well-being and therapeutic approach and, the psychology, there's some common themes coming through. I think, stepping to therapy is a big decision. And then it's same as like if you've never done running before and then you go for a 5K run, it's a big decision.
Very true.
It's true.
So it's a big decision, but once we started, and then like I would say, maybe Yalon said they used the words a direct look at the sun, look at the sun, and direct look at the fear, where the fear is, where's fears about,
I love that. What is it? Yeah, find out what that fear is and where it sits for that community even.
Yes.
Yeah.
Gosh,
And then face it head on. Yeah. Thank you.
And it's okay.
Thank you ever so much. Where can we learn more about you? It's been a really interesting talk.
So I have my website is gendutherapy.co.uk.
And we're actually going to be, I'm going to be a bit cheeky. So for our Test the Trend segment, usually I do an exercise and challenge people to try that. But Juan, do you mind sharing an exercise which is influenced by that fusion that of East and West or just different cultures that we could try, please?
This is, again, we are embraced creativity and innovation. Okay, so if you if it's okay for you to, and if you sit, make sure your chair is comfortable, make sure your back is self-supporting, and your feet is contact with the floor with shoes or without shoes. But basically you sit in an upright and position, dignified posture. Okay,
Dignified.
yes, and very good. And I want you to take a deep breath, breathing and breathing out. Breathing and breathing out. So feel your body is grounded, and your body, your shoulders relax, your legs relax, your arms relax. Okay. And I want you to pick up your pen. Yeah. Maybe have a sense of feeling the weight of the pen or pencil, whatever it is. Feeling the weight of it. Feel the material, maybe made of plastic, maybe made of metal, whatever it is. Yeah. Feel the weight in your hands. Yeah. And then I want you, if you can, close your eyes. I want you to feel the texture of the paper. It's smooth or it's not, whatever it is. The temperature of the paper. Yeah. So your body is, it's very relaxed. Your concentration is on the sensation of your hands holding the pen and you're touching the paper. Yeah. And I want you, no rushing. Just enjoying your breathing out. Yeah. And when you're ready, I want you really, maybe close your eyes if it's possible. And I want you to write down, things you like to do today. Could be anything. Things you would like to do at this moment. Or maybe next hour or this afternoon. Things you would like to do. Yeah? Could be something imaginative. Could be something, more realistic. Whatever it is. Not to judging. Just close your eyes and write that on the paper. Are we okay?
Mm-hmm.
Yeah? Okay. Okay. So, how is that? Okay?
Yeah, that's nice. And it's actually got some of the things when I was writing, I'm going away tomorrow, so I've got a lot of stuff to do. But writing it down got rid of a bit of that anxiety I could feel.
The tension.
Yeah.
Yes.
So
Oh, wow.
that was really good.
That's good.
Okay. Okay. So I want you to really look at it. If you got the list, or if, just a few words, a few sentences, or anything. When you look at those, yeah, really tapping things within you.
Yeah.
Yeah. Or that's the things you like to do today, at this moment.
Yeah.
Yes, and I'm actually going to do them now. I've written them
Yes.
down.
Yeah. Yeah. And even if they're silly little things, it's still
Absolutely.
really important. And it comes back to the self-care side of things. as well,
Exactly
doesn't it?
right. Exactly right.
Especially welcome those silly little things.
I love it. I love that, because actually when you look at them, they're not quite so silly after all, because I can actually find that deeper meaning behind them.
Yes.
So I've just, as an example, I want to go back and play with my dog.
I've written that. Walk my dog. I just want to spend time with my dog.
Yeah, but of course I'm not going to see my dog for the next week. So again, there's a
More
deeper
important
meaning.
for you,
I want to be out in the sun.
And
And actually,
that's
it's because
what I've
we're
written.
inside, and I know it's a really nice day. And
Yes.
so again, there's so much more meaning behind
Yes.
that. That is brilliant. Thank you so much,
Thank
Juan.
you.
That's really been so helpful.
That's okay.
Can you give us some top tips for best practice for taking a culturally sensitive approach?
Well, I think, it's the one thing that for me is always is a beginner's mind.
Yeah.
Yeah. And you have 10 years experience, 10 to years experience, or even longer, 30 years experience. And when you meet a person, drop that experience on the side. You meet this person as a human being. And you are a person, you are a human being.
That's yeah.
That's beautiful.
Yes.
Juan, thank you so much. It's been such a pleasure as always. We've reached the last part of the show. Such a great discussion.
It really was.
And one of those discussions that's really practical, because of course, it was when she said, and this is right from the start, all they do is they translate all the CBT training into a different language, and there you go, that's culturally sensitive.
Yeah.
It's not.
No, and I can't quite believe it. I can't quite believe that it's not leading, that this field is not leading the way into being culturally sensitive and aware, and it blows my mind.
And the other thing was, in that last exercise, the minute she said dignified, we both went, oh. But that's not a word we would normally use at all. And yet, it had that effect.
Yes.
And it just goes to show that power.
Yes, and I reckon that comes from Juan's cultural background.
Yes.
Because that's how I imagine
But
her
that's
culture,
very
dignified.
Chinese, actually.
Yes, and we wouldn't say that. You're absolutely
No,
right.
and then if we did, someone might take it wrong. Oh, what, you mean I'm not dignified? But
Yes, exactly. We knew exactly what she meant, and we.
both went, oh, that's a nice feeling. I feel very empowered now.
Yeah,
And
yeah.
then just because I know that's such a great show. There's
Yeah.
so much to talk about. Things that you wrote down. We both were saying stroking the dog, being out in the sun. What was
We both
anything
said
else?
that. Yes, and my third thing was, it's my 10-year wedding anniversary today. So I wrote, have a nice anniversary meal, because actually we have no plans, but it made me think, we need to have plans. So that's what I've written down. That's what I'm going to do.
And again, all of these things, maybe they were just top of the head things, and we might dismiss them otherwise. They might just be dismissed as thoughts.
Yes.
And yet now we're actually thinking, putting them into practice, and that's such a great piece of self-care and honouring. Again, there's another word that she's used a lot.
Lovely word.
Ourselves.
Exactly right. And they're very simple things to do. But you're right. They would have just been dismissed
So,
otherwise.
from Judith and I, honour yourselves this week and have a very good night.